This is the story of how California seniors gained the right to have savings and keep their health care, only to have that right taken away just 1 year later. On January 1, 2026, the Medi-Cal asset limit returns, and if you're over 65 with more than $130,000 in countable assets, you could lose your health coverage. California made history in January 2024 when it became the first state in the nation to completely eliminate asset limits for Medi-Cal, which meant seniors and people with disabilities no longer had to choose between saving for emergencies and keeping their health insurance. That freedom lasted exactly 12 months before the state reversed course in June 2025, citing budget problems, and brought the $130,000 asset limit back on January 1, 2026. Understanding what's happening now requires looking at how restrictive things used to be, and the numbers tell a stark story. Prior to July 2022, California imposed some of the strictest asset limits in the country for seniors trying to qualify for Medi-Cal. Single individuals could have no more than $2,000 in countable assets, while married couples faced a limit of just $3,000. $2,000 in savings for a single senior trying to survive in California. Your first car didn't count toward the limit, and your home was exempt, but everything else got scrutinized. Any cash in the bank counted, life insurance policies counted, even certain funeral plots counted toward that $2,000 threshold, which meant if you had $2,100 in savings, you were over the limit and ineligible. Medicare savings programs had a slightly higher threshold at $8,400, but that was still extremely low for people trying to maintain any kind of financial cushion. These programs help seniors pay Medicare premiums and co-pays, and the difference matters when you're on a fixed income. The acid test kept thousands of eligible seniors from getting help they desperately needed, not because they were wealthy, but because they had managed to save a few $1,000s. The rules weren't just strict, they were maddeningly complicated, and figuring out which assets counted and which didn't required knowledge most people didn't have. The Legislative Analyst's Office later found that these complex rules likely deterred many eligible seniors from even applying because they assumed they wouldn't qualify, or they got overwhelmed by the paperwork and just went without coverage. California started changing course in July 2021 when the state passed a law to eliminate the asset limit entirely, and the change happened in 2 steps. First, in July 2022, the asset limit jumped from $2,000 to $130,000 for an individual, with each additional household member adding another $30,000 to that limit, which was already a massive improvement over what came before. Then came the full elimination on January 1, 2024, when California removed the asset limit completely for all Medi-Cal programs serving seniors and people with disabilities. No other state in America had done this, and income remained the only financial requirement for eligibility. The reasoning behind this policy was solid and straightforward. Asset limits forced seniors to live in deep poverty just to access health care, which meant a senior could be eligible based on income but ineligible because they had managed to save $10,000 for emergencies. The old system punished responsible financial behavior and essentially told seniors that if you want health care, you need to be completely broke first. What happened next changed everything and caught state officials completely off guard. Far more people enrolled than the state had anticipated, with the senior Medi-Cal caseload growing by at least 112,000 people specifically because of the acid test elimination. Another 23,000 came in through the older adult expansion program, and by the time state analysts looked at the numbers, the senior caseload was approximately 225,000 higher than expected under the old pre-pandemic rules. Money drove the decision to bring back the asset limit, plain and simple. The acid test elimination cost California about $500 million more than projected, and that number matters because seniors use more health care than younger Medi-Cal enrollees. State officials confirmed that seniors cost about twice as much as the average enrollee because they need more medical care, which means when you combine higher enrollment with higher costs per person, you get a budget problem the state couldn't ignore. Newsom administration officials told the legislature that the surge in enrollment was contributing to California's growing fiscal pressures while the state was already dealing with budget constraints across multiple programs. Governor Gavin Newsom originally proposed bringing the asset limit all the way back down to $2,000, which would have returned California to the strictest rules in the nation. Assemblymember Pilar Schiavo, a Democrat from Santa Clarita, pushed back hard during a legislative hearing and warned that kicking seniors and disabled people off Medi-Cal would create even bigger problems. Her exact words were, "This is going to lead to more homelessness of seniors and the disabled. That's what's going to happen, and that will cost our state money too." The legislature and governor reached a compromise on June 24, 2025, settling on $130,000 instead of the proposed $2,000 limit. Each additional household member still adds $65,000 to the threshold, and the new rules took effect on January 1, 2026. Not everything you own counts toward the $130,000 limit, and understanding these exemptions can make the difference between keeping coverage and losing it. Your primary home is exempt no matter what it's worth, and your first car is exempt too, which are the two big protections that keep most seniors from hitting the limit immediately. Almost everything else counts against you, though, and the list gets long quickly. If you own a second property, whether it's a rental or a vacation home, the value of that property counts toward your limit. Cash in savings accounts counts, checking account balances count, life insurance policies count toward the limit, and even certain types of funeral plots are included in the calculation. Here's where it gets a bit tricky and requires careful attention. Your retirement accounts like 401ks and IRAs don't count as assets while the money is still in the account, which means the balance sitting in your retirement account is exempt. Once you start taking distributions, though, those payments count as income, and this matters because Medi-Cal also has income limits, so you need to track both. The average monthly private pay rate for nursing home care in California is $13,656 as of 2025, and that number becomes important if you need long-term care and you're thinking about giving away assets to get under the limit. Asset limits are only part of the story because California is also bringing back something called the look-back period, but only for people who need Medi-Cal to pay for nursing home care. This is separate from regular Medi-Cal coverage and operates under different rules. The look-back period went away on January 1, 2024, at the same time the asset limit was eliminated, and it's coming back on January 1, 2026. When you apply for Medi-Cal coverage for nursing home care, the state looks back at your financial history to see if you gave away assets or sold them for less than they were worth, and if you transferred assets improperly during the look-back period, you can face a penalty period where you're ineligible for coverage. The look-back starts at 1 month and grows incrementally. Beginning February 1, 2026, Medi-Cal will look back at transfers made in January 2026, and each month after that, the look-back period grows by 1 month. By July 2028, the look-back period will reach its full 30 months for any transfers made on or after January 1, 2026. There's a critical protection window that seniors need to know about. Any asset transfers you made between January 1, 2024, and December 31, 2025, will not be penalized, and the state specifically said those transfers won't count against you during 2026 eligibility renewals. This created a 2-year window where you could give away or transfer assets without triggering penalties. California allows one exception to the look-back rule that provides some flexibility. You can transfer assets up to the average monthly nursing home cost without penalty, and since that's $13,656 per month in 2025, you could gift that amount and not violate the look-back period. This provision existed before and continues under the reinstated rules. Not every senior on Medi-Cal has to worry about the asset limit coming back, and 3 specific groups are protected, at least for now. These groups all have one thing in common, which is they receive Medi-Cal directly rather than through a link to another program like SSI. The first exempt group is called PICL, the second is Disabled Adult Children, abbreviated as DAC, and the third is Disabled Widows and Widowers, known as DWW. If you're in one of these categories, the January 1, 2026, reinstatement doesn't apply to you, and your Medi-Cal continues without asset testing. California used separate federal authority to eliminate assets for these deemed SSI groups, which means to bring back asset limits for them, the state would need to submit what's called an 1115 waiver amendment. As of the reporting in late 2025, California had not submitted that waiver, though advocates expect the state will eventually reinstate asset limits for these groups too, but the timeline remains unclear. Timing matters significantly if you're trying to get on Medi-Cal or if you're already enrolled, and the hard deadline was December 31, 2025. If you applied for Medi-Cal before that date, you were evaluated under the old rules with no asset limit, but if you apply on or after January 1, 2026, you must meet the $130,000 asset limit to qualify. Current enrollees don't get kicked off immediately on January 1, 2026, because the state isn't going to check everyone's assets on that date. Instead, you'll be evaluated when your annual renewal comes up in 2026, and that's when you'll need to document your assets for the first time since the limit was eliminated. The state mailed notices to all affected enrollees in October 2025, and those notices explained the changes and what documentation would be required at renewal time. If your assets are over $130,000 when your renewal happens, your coverage will be terminated at that point, which gives current enrollees some time to plan. New applicants face immediate scrutiny starting January 1, 2026, when every new Medi-Cal application for seniors and people with disabilities includes asset verification. You'll need to provide documentation of everything you own that counts toward the limit before your application can be approved. Many California seniors use both Medicare and Medi-Cal in what's called dual eligibility, and this combination is common because Medicare is your primary insurance, but it doesn't cover everything. Most notably, Medicare does not cover long-term nursing home care, and Medicare also requires co-pays for many services. Medi-Cal fills those gaps for dual-eligible seniors. Medi-Cal pays for long-term care, covers the co-pays that Medicare requires, and for seniors on fixed incomes, these supplemental benefits make healthcare affordable. The asset limit reinstatement creates what some call a financial cliff for people turning 65, and here's how that works. Before you're 65, you might qualify for Medi-Cal under different rules, but once you turn 65 and become Medicare eligible, you shift into the seniors category, and that's when the $130,000 asset limit applies. You could be receiving Medi-Cal benefits at age 64 with $150,000 in savings without any problems. The month you turn 65, you're suddenly over the asset limit for the senior program, which means you don't lose Medicare, but you lose the Medi-Cal coverage that was paying your Medicare premiums and co-pays. More than one-third of all Californians are enrolled in some form of Medi-Cal, which makes it one of the largest health insurance programs in the state. Seniors represent a relatively small portion of total enrollment, but they account for a disproportionate share of costs because they use more healthcare services. From 2015 to 2019, before the pandemic changed everything, senior Medi-Cal enrollment hovered between 18 and 18.5% of California's total population over 65. As of January 1, 2025, California had an estimated 6.5 million residents aged 65 and older, which means if 18.5% of them were on Medi-Cal, that would be about 1.2 million people. The senior caseload grew significantly during and after the COVID pandemic, jumping by just over 20% between April 2020 and June 2023. Some of that growth came from continuous coverage policies that prevented states from removing people during the public health emergency, but growth continued even after those policies ended. Sharp increases in the In-Home Supportive Services Program, known as IHSS, suggest the Medi-Cal changes have ripple effects beyond just health insurance. IHSS helps pay for caregivers who assist seniors with daily activities like bathing, cooking, and cleaning, and when more seniors qualify for Medi-Cal, more of them also become eligible for IHSS. That creates additional costs for the state beyond just medical care and compounds the budget pressures officials were already facing. Numbers and policies don't capture what these changes mean for real people living real lives. Cal Matters featured the story of Cindy Soto, a a quadriplegic who has been on Medi-Cal for most of her life and requires around-the-clock care to survive. Soto received a modest inheritance of about $8,000, and that money helped her cover daily expenses and gave her a small financial cushion. Under Governor Newsom's original proposal to bring the asset limit back to $2,000, she would have lost her health insurance entirely, though the compromise to keep the limit at $130,000 protected her. What her story illustrates is how close she came to losing everything over a small inheritance meant to help her. The Legislative Analyst's Office found that a significant share of California seniors living in or near poverty were eligible for Medi-Cal based on income but couldn't qualify because of the asset limit. These were people who had managed to save a few $1,000s for emergencies, maybe $5,000 in the bank to cover an unexpected car repair or a broken water heater. The old $2,000 limit forced them to choose between financial security and healthcare, and that's not a choice anyone should have to make. Assemblymember Schiavo's warning about homelessness wasn't hypothetical or political rhetoric. Seniors who lose Medi-Cal coverage might not be able to afford their medications or might skip doctor visits for chronic conditions. If they need nursing home care but can't get Medi-Cal to pay for it, they could end up in homeless shelters or on the street, and the cost of addressing senior homelessness, both in human terms and in actual dollars, likely exceeds whatever the state saves by limiting Medi-Cal enrollment. The Medi-Cal asset limit reinstatement only affects Medi-Cal and does not change the rules for SSI, which is supplemental security income. SSI has always had its own separate asset limits, and those limits remain in place regardless of what happens with Medi-Cal. CalFresh, California's food assistance program, is also unaffected, and the Medi-Cal changes don't alter your CalFresh eligibility one way or the other. The same applies to other cash assistance programs because each program has its own rules and eligibility criteria. There are interactions worth understanding, though, because some people receive Medi-Cal automatically when they qualify for SSI. The asset limit reinstatement could create situations where someone is eligible for SSI but not for Medi-Cal, or vice versa, depending on how much they have in different types of accounts and how those accounts are structured. Medicare savings programs, which help pay Medicare premiums, previously had asset limits around $8,400 before the 2022 changes, and how those programs interact with the reinstated $130,000 Medi-Cal limit may vary depending on your specific situation and which programs you're trying to access. If you're approaching the $130,000 asset limit or already over it, you have some options, but they require careful planning and proper execution. The most straightforward approach is spending down assets on things you actually need, and you can use savings to pay off debts, make necessary home repairs, or buy a reliable car to replace an old one. These are legitimate expenses that reduce your countable assets while improving your quality of life rather than just burning through money. You could also convert countable assets into exempt assets and change how your wealth is structured. For example, if you're renting and you have significant savings, you might use that money toward purchasing a home because your primary residence is exempt, which means moving money from a savings account into home equity removes it from the asset calculation entirely. Transferring assets to family members is far more complicated because of the look-back period for long-term care, and this is where people get into trouble. If you think you might need nursing home care in the future, giving away assets now could make you ineligible for Medi-Cal coverage when you need it most, and the penalty period could last months or even years depending on how much you transferred and when. The protection window for transfers made between January 1, 2024, and December 31, 2025, offers some opportunities that won't exist going forward. Transfers during that period won't be penalized in 2026 renewals, but you need to document everything carefully and understand exactly what you're doing because improper transfers can have serious consequences. Navigating Medi-Cal asset rules is complicated enough that most people need professional assistance, and several organizations provide free help specifically for seniors dealing with these issues. The Health Consumer Alliance, known as HCA, has published detailed fact sheets about the asset limit reinstatement in multiple languages, and they offer guidance on what the changes mean and how they might affect your eligibility. You can find their materials online or request them through their offices if you need paper copies. Justice in Aging is another advocacy organization that has been tracking these policy changes closely and published a comprehensive FAQ specifically about the asset limit reinstatement in November 2025. The document explains who's affected, when the changes take effect, and what steps you need to take to protect your coverage. Neighborhood Legal Services of Los Angeles County, abbreviated NLSLA, provides direct legal assistance to seniors dealing with benefit issues and has helped people challenge eligibility determinations and resolve problems with the system. One consumer assisted by NLSLA said the organization was a godsend when dealing with a complex Medi-Cal issue that seemed impossible to resolve alone. California Advocates for Nursing Home Reform offers resources specifically about asset transfers and the look-back period, and if you're concerned about long-term care planning, they have information about how to properly structure your finances without triggering penalties that could leave you without coverage when you need it most. The California Department of Healthcare Services, DHCS, is the state agency that runs Medi-Cal and maintains a webpage with program changes and updates. While it's not always the easiest information to understand, it's the official source for current policy and the place to check for any last-minute changes or clarifications. The decision to reinstate asset limits didn't happen in a vacuum and reflects a fundamental disagreement about how to balance budget constraints against the needs of vulnerable populations. Supporters of the reinstatement point to fiscal reality and argue the state faces genuine budget pressures across multiple programs. The $500 million in unexpected costs from acid test elimination had to come from somewhere, and when enrollment exceeds projections by 225,000 people, with each of those people costing twice as much as the average enrollee, the numbers add up quickly and create real fiscal problems. From this perspective, the $130,000 limit is actually quite generous compared to what most states allow, and California still has one of the highest asset limits in the country. Seniors with $130,000 in savings are not living in poverty by any reasonable definition, and they have resources they can use before turning to public assistance funded by taxpayers. Opponents see it differently and argue that forcing seniors to drain their savings before qualifying for healthcare is cruel and counterproductive. A senior with $130,000 in the bank has basic financial security and can handle emergencies without going into debt. They have something to leave to their children or grandchildren and represent responsible financial planning over a lifetime. Making them spend that money down to qualify for Medi-Cal doesn't just hurt individuals but hurts families and communities in ways that cascade outward. When seniors have no savings, they become more vulnerable to exploitation and financial abuse, can't help family members in crisis, and have no cushion if something goes wrong with their housing or health. The homelessness argument carries particular weight in California, which already struggles with one of the nation's highest rates of senior homelessness. Seniors who lose Medi-Cal coverage might not be able to afford nursing home care when they need it, and without family support or other options, they end up in hospitals, emergency rooms, or on the street. Treating those outcomes costs more than maintaining their Medi-Cal coverage would have cost in the first place, which undermines the fiscal argument for the policy change. The reinstatement of California's Medi-Cal asset limit represents a significant policy reversal that affects hundreds of thousands of seniors. Those who gained the freedom to have savings and healthcare simultaneously lost that freedom after just 12 months, and the $130,000 limit that took effect on January 1, 2026, is more generous than the old $2,000 threshold, but it's still a limit that forces difficult choices. If you're a senior approaching or over the asset limit, you need to act now and get your documentation in order. Understand what counts toward the limit and what doesn't, and if you're already enrolled in Medi-Cal, prepare for your 2026 renewal by gathering the required paperwork. If you're applying new, know that the rules have changed and the application process will require asset verification before you can be approved. The policy debate will continue because budget pressures aren't going away, and neither is the growing senior population that needs healthcare. California's experience as the first state to eliminate asset limits entirely provided valuable data about what happens when you remove those restrictions, and more people enrolled than expected while costs ran higher than projected, which led the state to pull back. Whether this represents good policy or bad policy depends on your perspective and what you value most. What's clear is that thousands of California seniors now face renewed uncertainty about their healthcare coverage, and some will navigate the new rules successfully while others will fall through the cracks. The $130,000 asset limit is now the line that determines who gets help and who doesn't, and that line will shape the lives and health of California seniors for years to come.